Good evening, everyone. Wynn Brown here with Heywood Healthcare's COVID-19 update for Wednesday, the 4th of November. I hope you all had a good day today. I'm just going to give you a brief update on things that are going on in the Heywood Healthcare family. First, going right to testing, as we usually do. Our cumulative testing positive rate throughout the pandemic is at 2.3%, which is slightly below the state's ongoing average of 2.5%. Our 7-day rolling average is down to 2.07%, but still surpassing the state at 1.78. So again, a lot of positive seems to be coming through in our community, and I just encourage you all to practice all the safe practices that we've talked about a number of times. Wear your mask, social distance, wash your hands, those kinds of things. Please do that. We need to make sure that we're all doing our part. Across the state, 6,271,886 tests have been conducted for COVID-19. They're no longer providing us at a state level the net number of people that is, because as you know, a number of people have more than one test, but that over 6 million tests have been done. In Worcester, in the state, we're over 10,000 deaths, 10,035. Worcester's total cases are at 17,201 throughout the pandemic, with 1,180 deaths. At Heywood Hospital today, we have 5 COVID positive patients, 3 on Watkins 1 and 2 in our ICU. Just of note, and you'll see all of this embedded with the email as well, we have actually conducted over 30,000 tests at Heywood Hospital since the beginning of the pandemic. So if you think about your community hospital and our urgent cares and our testing sites, that's a large number of tests. We've also begun tracking influenza, because it is flu season is upon us as well. We've done 64 rapid tests at the tent and 1 positive. So we are beginning to see the influx of influenza in our region. To our staff, as you know, we opened it up so that all of our staff could be tested if they wanted to be, after we had a small surge on our Jerry Psych unit, which we discharged those patients or moved them to different areas of care and then reopened it after a deep clean. So of those 1,507, we have 1,470 negative results back, 3 positives, all of which we know are to be community acquired and not acquired at the hospital through our tracing methodology. There have been 4 total indeterminates, but all 4 indeterminates have since retested negative. So just to let you know those things that are going on. Just to encourage you, as you're experiencing your care or working at Heywood, see something, say something. We have a patient satisfaction or just a feedback line for people at 630-6100. So if you want to share a great story with us of great care, or maybe you have a concern or an idea of how we could do something differently, please use 630-6100 and let us know, and we will do our best to respond. Also, as we've changed the entrance at our south entrance on the Heywood Hospital campus, you're being routed through the emergency department waiting room as part of our queuing. There's been some questions about what's going on in there. We have a negative pressure area in there that we can use if need be. And so people are just really concerned, what is that there? That is something we put up early in the pandemic to make sure we had negative pressure available. I know that the look is not nearly as hospitable as we would like it to be, but really we're taking every precaution we can be to keep staff and patients safe. So please know that those are important safeguards we have and ready for us. So that's my report for tonight. I appreciate everything everyone in the community and on all our staff are doing to keep our community safe and well as we continue our journey to be one of the best community-owned health systems in America. Have a great night, everyone.